A lot of us were feeling useless, kind of helpless about the situation, that we weren't being in the clinic to help providers who are overloaded, overworked, stressed by taking care of their normal flow of patients in addition to patients who have possibly contracted COVID-19. And so a lot of us are looking for different ways that we can still contribute to the community.
Casey Scott is a third-year medical student at the University of North Carolina. When she found out she wasn't going to be able to attend clinical rotations due to COVID-19, Casey, along with her classmates, began volunteering and calling rural clinics to see what resources they needed before the pandemic hit the state. One of the main concerns was a lack of PPE.
This is one headband, and so we're going to have to remove all of this extra plastic here.
With the help of 20 classmates and a few local 3D printer technicians, Casey began working on making face shields for clinics in the western part of the state, who serve residents that tend to be older, poorer, geographically isolated, and more likely to be in worse health than their urban and suburban counterparts.
Today we are going to finish up polishing the face shields, and then we will bag them and take them back to UNCA so they can be sterilized.
We're just discarding too, right? Mark?
Yeah. Oh, yeah. Okay. I'm glad you mentioned that.
Mark Hursty is helping Casey and her classmates by printing, sterilizing, and packaging PPE.
These shields will be light disinfected in a booth that we've set up down in the chemistry department with quite strong lights, UVC lights, that kill bacteria and viruses within seconds.
Hey.
Once he sterilizes the equipment, Mark hands it back off to the students to deliver.
And just remind them that they can use the bag, not to treat the bags nicely so they can use them for the finished face shield.
Right now, there are upwards of 5,000 cases of COVID-19 in North Carolina, 329 of which are in the rural region that Casey and her team are making face shields for. Dr. Brian Hodge heads the Rural Health Initiative at UNC Health Sciences at Mayheck. He's also leading the rapid response team for the coronavirus pandemic in the region.
Even in non-pandemic times, these rural communities have, on a whole, less access to care and less resources as a medical community. We're trying to assess our resources in rural areas. At the same time, we're also trying to make sure that we have a regionalized approach.
Since this project started, the number of orders for face shields has only gone up. The team has been getting requests from clinics and even a local health department. They've also received a local grant to start making test swabs.
We have distributed, by the end of next week, it'll be about 68 or 70 face shields. This week was 38. If you had told me right before I started my third year that my clinical rotations were going to be suspended, then I would be distributing face shields across the region, I would have probably laughed in your face.